Hi, I'm Sherry Harlan, program host for Reid Beside You. And today our guest is Erica Millsap with the Reid Stroke, and she's the Reid Health Stroke Program Educator. Let me get that out here. So, welcome, Erica.
Thank you.
And exactly what brought you to Reid?
I actually started at Reid right before I graduated college. I went to college here at IU East in Richmond, and I actually transitioned there as a student nurse technician. And then when I graduated, I started with my bachelor's degree there as a nurse on the progressive care unit. And then I just actually recently, in the last 3 months, transitioned as the stroke program educator for the stroke program at the hospital.
Well, that's great. And we're always excited to have homegrown people added to our staff at Reid Health. One of the things today, since we're going to be talking about stroke, what is your role as the stroke program educator?
So I actually have a really awesome opportunity at the hospital to educate not only our staff, so I educate them on all the new protocols and evidence-based research and practice, but I also have the opportunity to educate our patients when they come in, if they have risk factors for a stroke or if they've had a stroke, and I also have the opportunity to then educate the community. So we're trying to prevent strokes in our community and try to live healthier lives, and so I have the opportunity to go into the community and provide that information.
And I'm sure that when you do see people as they come in, are they mainly through the emergency room, or are there doctor referrals?
We can see them from all different types. Most of the time we do see them through emergency or like rapid response, so EMS brings them in. Sometimes they just come in through the emergency department as well.
And so you were saying how you were, your experience at Reid, but how did you start working with the trauma area?
Actually, I have just always really enjoyed education. It's really why I went to school in the first place, and this was just a wonderful opportunity. I had worked with the progressive care patients, which we admit most of the stroke patients at the hospital, and so I had become very accustomed to caring for these individuals, and I just had a lot of passion involved with that. So.
And I'm sure with the strokes, you work more with neurology, the neurologists that are on
Most definitely. Our neurologists are absolutely wonderful. I would recommend them to anyone, and they work very closely with our program, both on the inpatient and outpatient for follow-ups for.
And when you're saying that, so you're working also with inpatient as well?
Yes, correct. Mostly inpatient. We do, in certain specific situations, we visit the neurology office to follow up with patients that might require a little bit more detailed education or just would prefer like a nurse's perspective.
And we also, when we hear stroke, you hear so many different stories with stroke victims, survivors.
Certainly.
So as you often hear that stroke is preventable.
Yes, definitely. So there are two different types of strokes. You can have what's considered a hemorrhagic stroke, or you can have an ischemic stroke.
And can you share the differences?
Most definitely. So it's really important to understand, I think a lot of individuals have the misconception that a stroke is only caused by high blood pressure, but it's not. And the difference is in an ischemic stroke, it's generally caused by a clot. A clot prevents blood flow to the brain, whereas in a hemorrhagic stroke, a blood vessel actually bursts in the brain and then blood begins to seep out, and that's what causes the damage.
As well as with the differences in that between the clotting or just a burst, and can that determine the severity of the stroke?
Most definitely, yes. We care for mostly ischemic stroke patients or when there's a clot, and if there's a hemorrhage, most often we're going to send them to a higher level of care so that there's a neurosurgeon on staff that if they required surgical intervention that they could have that. And we do, unfortunately, there are a lot more deaths secondary to stroke in the hemorrhagic stroke patients.
And under the prevention, we hear, how can that be prevented? So are we looking, what are some of the keys for prevention of stroke?
Certainly. I think that it's important to remember the statistic that I always like to share is that 80% of strokes are actually preventable. And so how you can prevent a stroke from occurring is like modifying your risk factors. So we know that there's certain risk factors that contribute to having a stroke. So what we always encourage, is to go to your wellness visit. So during your wellness visit, they're going to take your vitals, they're going to check your blood pressure, your heart rate, which are major screening tools. They're also going to generally perform basic lab panels. So we're going to look at your blood sugar, we're going to look at your cholesterol, because we know that individuals that have diabetes or have increased cholesterol have a higher risk for having a stroke. We encourage smoking cessation or quitting smoking because it definitely impacts how your arteries and your veins handle and I guess it can contribute to a stroke. And then we also definitely want to encourage you to modify your diet to decrease cholesterol as well as monitor sugar and salt. And we also want to encourage physical activity because the American Heart Association, American Stroke Association encourage at least 30 minutes of physical activity at least 5 times a week to be healthy.
And on those preventative issues, a lot of more and more companies have wellness screenings, or they are requiring people to look into those wellness opportunities. And often people say, "Oh, I don't need to do that," or "Is that really necessary?" And this really shows that.
Most definitely, it shows that it's your life. You know, it's going to impact. It could impact your livelihood and your quality of life. So it's important.
Also, with smoking cessation, often people don't want to hear that. It's I'm a smoker, I'm going to stay a smoker. But we're seeing that does add to the impact of the severity, or as well as just having a stroke. Correct?
Yes, correct. Very correct.
When you're saying with diet and as well as physical activity, is there some you were saying with different salts and sugars? Anything else that
it's just really a healthy diet. So they recommend American Heart Association and other reputable sources recommend it's called MyPlate. So it's a healthy, portion sizes matter. So increasing fruits and vegetables, decreasing things that are high in fat or high in cholesterol, which are a lot of our fast foods. So kind of eliminating that from our diet.
And what are some of the warning signs?
Oh, this is the thing that I think is the most important, because I think that we all, anyone in the community can recognize these signs and symptoms. You can be the person that quite literally saves someone's life. So it's unfortunate that stroke sometimes mimics other different diseases. So sometimes, say somebody would have low blood sugar, they might be confused. But what you want to remember with a stroke, confusion is generally very quick. Like there's a very fast onset, and all of a sudden they're just not acting normal. You might notice changes in their face, weakness on one side, poor gait, poor mobility. They could have a headache that's just very severe, that just kind of came out of nowhere. So recognizing those signs and symptoms is important. So actually, the American Heart Association, American Stroke Association have created this acronym that is extremely helpful, very easy to remember, and actually Reid is very great at marketing this, and I provide this to all of my patients that come in. And so that acronym is FAST. So I'm going to kind of break it down a little bit, because when you say it so fast, it kind of slips by you. So FAST stands for this symptom. So you want to act fast. So we want to recognize of changes in someone's face, which is the F. So if they have facial drooping on one side, then the A stands for arm weakness, and it can be on the right or left side. Generally, we do see stroke symptoms that are going to be unilateral or on one side. So that's the A, the arm weakness. Then the S stands for speech difficulty. So if somebody's slurring their words or just not coming across right, they can't get those words out, that's the S, so speech difficulty. And if they have any of those three symptoms, the T stands for time. So it's time to call 911. It's time to seek intervention.
And just by looking at the FAST, as we look at that, how important is that to the actual victim as well as to the people around them?
Certainly. So what FAST really is recommending, it's seeking medical treatment or advanced treatment. So it activates, if you activate like an emergency response or you activate EMS and you call 911, that's the recommendation, because the quicker that you get to the hospital, the more that we can do for you. So the phrase that they like to use is time is brain. So the more time that you are experiencing these symptoms and you think, it's just going to go away, it's going to get better, your actually brain cells are dying, and they might be brain cells that we can never like rejuvenate or get back to their best self, and so then you might not recover to your fullest.
And then also just to the public, I actually have had 2 strokes, and both times I was in close to a medical facility.
Right.
Or else received help quickly. People noticed that my face drooped, and I had lost the feeling in a hand, so immediately got service. As you can see, I'm still talking and walking, and
Right.
So the quicker that people get help, the better.
Certainly.
The as they're saying, 80% of the strokes are preventable. And stroke is the 5th leading cause
Correct, yes.
of death.
Yes.
So we want to make sure that people are aware of that. And there's millions of people that are affected by stroke each year.
And we consider them stroke survivors because through rehabilitation, physical therapy, occupational therapy, these individuals can get to their best self, and they just can overachieve, and they can do wonderful things. And it's so exciting, just like your success story, to see where we can go.
One of the other things is, because of that, and with all your great work, a new venture that will be at Reid Health is the new stroke support group. Can you share with us about that?
Yes, we are so excited. So in April, actually, we received our primary stroke certification, which means that we can triage and care for patients at such a higher level than we could before. And so now, with that built and already in process, we're transitioning to also building a stroke support group. So this is for our stroke survivors. So now that we're serving such a larger community of individuals, we want a place for them to come and talk about what they've been going through, what they've found to be challenging, and where they've overcome so many obstacles. And it's really just an opportunity. We're going to provide some education and some food, of course, but we also just want an opportunity for everyone to share, because you're going to learn more from others that have gone through the same thing as you have.
And how can they attend those events?
So you can actually RSVP to me. Our next one will be towards the end of February, so we would appreciate you just looking. The Reid Facebook page always has information, and they'll also probably be publicizing it elsewhere, but we're just really excited, and the information, whenever you see one of our flyers and everything, has my email contact and everything. So.
Okay, well, that's a lot of information,
Yes.
and we want to thank you, Erica, for joining us and sharing the information about the Stroke Educator Program.
Thank you so much.
And thanks for joining us.
Hi, what seems to be bothering you?
Hey Doc, I got a fever and chills. I really don't think I should be on the road.
Okay, I think that's something we can help you with.
Real-time care anywhere. Reid Health Now, right beside you.
Hi, how can I help you?
My daughter has a fever and she isn't feeling well.
Okay, let's get her feeling better.
Receive quality care within the comfort of your own home. Reid Health Now, right beside you.
Hi, I'm Sherry Harlan, and welcome back to Reid Beside You. Our next guests are Misty Faust-Cofield, Vice President and Chief Nursing Officer for Reid Health, and Ryan Williams, who's our Director of EMS Forensics and Trauma Services at Reid Health. And welcome to both of you.
Thank you for having us, Sherry.
Thanks for returning to the show. The last time we spoke, Reid was undergoing our training for certification for our level 3 certification. How's that going?
It's
It's going well. We were verified last year in 2017 for a 3-year verification. So as a level 3 trauma center, so it's gone well. The visit was successful, and now we're just kind of maintaining and preparing for the next steps.
And how's that certification enhanced our abilities to serve our community?
In a multitude of ways. I mean, part of that is evaluating all of your processes that you have within your facility, not just necessarily injured patients, but how does everything work together? So laboratory, radiology services, everything intertwines how it all works together, including disaster preparedness as well. So we look at all of those processes and try and enhance them as best we can. So no matter what happens to the patients or to the community, we can be ready for them.
And our community, unfortunately, just has experienced 2 traumatic events, one being the fire at Interfaith Apartments, and the other, the shooting at Dennis Intermediate School in Richmond. So can you explain how your trauma team helped and what they did during those 2 events?
Sure. So we have, if you're not familiar, we have 2 response vehicles at the hospital that allows some of our team members to actually respond out, including 2 of our physicians that can respond out to critical incidences.
And I wanted on that when you said the physicians, are they in those trauma vehicles
They
that
are.
people see?
Yeah, Dr. Emily Kraft, who's the EMS medical director, and Dr. Sam Iden, who's the emergency department medical director, both have the ability to respond out to the scene with us. And so we were on both scenes to just lend support to the already first responders that were on scene. Our job is to just show up and ask what we can do to help. Is kind of the big thing, but then the thing that allows us we can communicate back to the hospital directly from the scene, kind of what we're seeing, what we're going through, what's happening, how many victims are there. So then the hospital is able to prepare what we're seeing through our eyes, kind of how to prepare the emergency department and the whole hospital then on the influx of patients that we could potentially receive.
And then on the other hand, with the Dennis Intermediate, with the shooting, it seemed that it drug on a little longer because we had, as you were getting children, that they had to be transported to a different location. How did we interact in that particular setting? You want to
Sure,
speak on that,
absolutely. I'd be happy
Misty?
to share. So with that setting, as the kids and the children and staff and parents were transported to, I believe, the high school, the Tiernan
Correct.
Center, we were able to deploy 6 trauma-trained social workers who helped on scene with the kids who were undergoing a variety of issues related to the events that transpired that morning, and they were able to intervene with the students, with the staff, and with the parents, their social work background. So they provided counseling and in-the-moment support for those team members.
And from our understanding, a lot of that, we really had to work with some of the parents who this was something totally unexpected. So I think students have gone through those drills, but you never, when you're dealing with the parents, that's always another factor coming in.
Absolutely.
And so I'm sure with the counselors on staff, that was very helpful.
Yes, absolutely. And with the multitude of individuals that we had to transfer with a high number of students, we were very fortunate to be able to supply that resource to the community.
And that's a very special
Yes.
opportunity that's new. We don't often want to use that, but we have those resources that are available, so that's always good to see.
Yes.
The other thing is, as 2019 comes in, we have a new service,
Yes,
and our new endeavor, ambulance service.
That's correct.
In the Dublin area.
Yes.
correct.
Let's say, can you give me some updates on that?
Sure.
And the reasoning why
Sure.
you went into there.
I don't know if you want to speak to that
Sure, I
part-
can give you a little bit of the background of the
Okay,
reasoning
could
of
you
how
please?
we got to where we are, and then Ryan can probably update you on where we are at the current time.
Okay.
But in late October, we became aware of a situation in the Dublin, Cambridge City area that there were no bids submitted for that part of the 911 county contract. We saw that as a team as an absolute crisis for that community. Being without 911 service is not something that we were willing to sit back and see transpire. So we broke into action very aggressively, stayed up late hours into the night and all day, working to get a bid together and a proposal for that coverage area. Also, with that being said, there was also a lack of bids submitted for the Hagerstown area, so we did bid that area as well. We were granted the submission for the Dublin-Cambridge City area, and we assumed coverage of that contracted area New Year's Eve.
Yeah.
Wow.
Yeah.
And so did we buy ambulances? What can you share?
Yes.
We did. We bought three new ambulances. Luckily, we had some vendors standing by when we submitted the bid, just so we kind of had everybody on standby in case, if, in the event we were awarded a contract, that we kind of had everybody ready to go. So we bought brand new equipment, including heart monitors, cots, ambulance cots, the equipment needed to take care of the patients in those areas. So we have one truck that's up and running. It went into service with a mutual agreement with Dublin EMS, who was currently serving the area. They've been fantastic to work with. We took over for them at New Year's Eve at 7 o'clock. And actually got our first run 54 minutes into the hour. So, and so we have one truck that's staffed 24/7 over there with a paramedic.
And that is located in Dublin, correct?
It is currently located in Dublin. Yes. Yeah.
And the other ambulances, are they at Reid or they're?
They are still in the process of being stocked
Okay.
to where we can get them certified, and then the plan was to probably use those, one as a backup for that 911 truck over in Dublin, but then to be able to do transfers, our own transports out of the hospital.
And the EMS personnel?
Yes.
How did we find those people?
Yes, we have had an outpouring of EMTs and paramedics from the community. With these positions, we do offer a very competitive salary, and we also offer full benefits. So I would say the EMT and paramedic community have received this opportunity with arms wide open, and we've had a great response.
And for that particular community, that's something new, having the benefits.
Yes, that's not typical, and Ryan
Right.
can speak to that. But
Yeah, I mean that's one of the things that it faces, the challenges that faces that type of employment is some of the volunteer fire departments or some of the agencies that are smaller, they struggle with being able to provide that. No fault of theirs, it's just it's a
Right.
huge expense, and so that's something that the hospital, having the size that we are, can actually supply that. So it is helping. It's
And
nice.
these
to
are
be able to-
full-time?
We have both. We're hiring full-time, part-time, PRN. It just depends on what they're interested in. It's common amongst EMS providers to kind of work at multiple different agencies, which is fine. I think it kind of helps build the relationship with all the agencies. So.
And with that, as we are trying to work with the community, how are we getting the information out to the community?
A variety of ways. So
Okay.
this being one of the ways. Ryan and I have also provided communication through the county commissioner meeting that has been televised, also through local media agencies with Kix 96, The Point, a variety of
Social
other
media.
ways, social media. Yes. So.
And a big question people just assume, and I'd like to clarify, because it's a Reid Health ambulance, how do you determine what hospital or provider that they would be transported to?
Sure.
Can you delve into that, please?
Sure. So first and foremost, it's based on patient choice. Patients have a choice of where they want to receive their health care. It's no different just because our name is on the side of the ambulance. So for the folks in the southwest part of Wayne County, if they choose to, if they currently are getting their health care at Fayette Regional or Henry Community, if they're established here, that's what's best for that patient. They need to go where they're established. There's a couple things that come into play for that. Obviously, you just had Erica on talking about stroke education. So places that are, designated as certain things, trauma, stroke, if you're having a heart attack, things of those natures might change that, and we would encourage them to go to the closest hospital that's set up for those types of illnesses or injury. But for the first and foremost, it's based on the patient's choice. So.
As well as whatever the particular crisis
Yes.
involved. And so,
Right.
of course, we're going to get them to the place that would serve them best.
Correct.
Absolutely.
Correct.
As we move forward, do you have plans to expand, or We just want to get through this correct.
We need to get through this first phase first, I think. It's been a whirlwind. It was putting the program together in a short amount of time. So I think we need to, this is easing ourselves into getting used to the providing the service.
And I can't neglect that we want to thank for both Misty and Ryan for all their long hours on getting this put together so quickly, as well as getting the certifications, and I'm sure trying to order all the new supplies and different that, as well as interview people.
Yeah,
You've done an amazing job on putting this all together so quickly.
I appreciate that. It's been a complete team effort. We've had a whole team of people within the organization that have truly stepped up and helped, not just Misty and I. I mean, there's been a whole team of people that have helped. But everybody identified that this was the right thing to do. It's the right thing to do for the community. No different than when we did the trauma verification. It's the right thing to do.
As well as I remember when you were first saying you're going into trauma, and now you have a larger team. Approximately how many people are involved? I know the entire hospital is involved, however, just strictly trauma.
So it's hard just because the trauma program does hit multiple entities within the actual department itself. There's currently 4 of us that actually work day in and day out with the daily operations of the program. But it still includes team members in the emergency department, the critical care unit, lab, X-ray. They're all part of the team.
But the bigger issues, is anything else that you would like to share as we move forward into showing more as the trauma team starts to grow and how that affects Reid Health?
Well, I think the main thing is we are excited for this new adventure in Southwest Wayne County. We're excited to partner with our EMS partners who are already established in that county and continue to embrace those partnerships and grow. And we will continue to provide the medical directorship for many of the EMS services in our county, as well as equipment that we provide at no cost to those services. So we look forward to continuing with those relationships.
Absolutely. As far as trauma, one of the big campaigns we're doing right now is Stop the Bleed campaign, which is a nationwide initiative of controlling bleeding. Anybody that's bleeding, it's meant to teach the common layperson. And so Jacob Cox, who's our injury prevention coordinator, has been working with the schools prior to the Dennis intermediate school incident and getting these kits into the school systems. And so I think that that's important. I would also mention that I think just in general as a trauma program, to see these 2 incidences happen and to see the entire community come together and for us to help be part of that, it leaves me speechless often just to see the community outpour in the response to that.
We're going to wrap up, but I also can't wait to have you back so we can talk more about the Stop the Bleed program and what you're doing within the entire service area for Reid Health. And I want to thank you, Misty Faust-Cofield and Ryan Williams, for joining us today on Reid Beside You.